You're eating well, exercising, cutting back on salt, maybe even losing weight. And every time you sit down to check your blood pressure, those numbers keep going up. That's not just frustrating. That's a sign something is being missed. Today, I'm uncovering 3 hidden conditions that can drive blood pressure through the roof even when you're doing everything right. Conditions that doctors miss all the time and that, if caught and treated, can completely transform your numbers. I'm Dr. Mandy Thomas. These aren't the usual suspects. We're not talking about pizza or skipping the gym. We're talking about conditions hiding in plain sight. Drop a comment right now. Has your blood pressure ever resisted everything you tried? I want to hear your story. First, what secondary hypertension actually means. Most people know the common causes of high blood pressure: too much sodium, not enough exercise, extra weight, chronic stress. These are real and they matter. But sometimes blood pressure is high because something else is driving it, a specific, identifiable, treatable underlying condition. When that cause gets missed, you end up on more and more medications that aren't solving the actual problem. Your doctor is puzzled, your numbers stay stubbornly high, and nobody has looked for the hole in the boat. Doctors call this secondary hypertension, and today we're exposing 3 of the most commonly overlooked causes. I'm calling them suspects, because that's exactly what they are. Suspect 1, the salt hoarder. To understand this one, you need to know about your adrenal glands, 2 small glands sitting right on top of your kidneys. Among other things, they produce a hormone called aldosterone, whose job is to tell your kidneys to hold on to sodium and water. Under normal circumstances, this is a healthy, well-regulated process. But sometimes, one or both adrenal glands become overactive and start producing far too much aldosterone. This condition is called primary hyperaldosteronism. When it happens, your kidneys get the signal to retain massive amounts of sodium they should actually be clearing out, and water follows sodium everywhere it goes inside your body. So blood volume climbs, like overfilling a garden hose. More fluid in the same size pipes means more pressure against the walls. That pressure shows up on your cuff. The frustrating part for seniors with this condition: many are already watching their sodium intake carefully. They've cut processed foods, they're not adding salt to anything, and they cannot understand why their blood pressure is still high. The problem isn't coming from the outside. Their own adrenal glands are manufacturing it regardless of what they eat. Warning signs: the salt hoarder might be your suspect. Blood pressure that stays elevated despite 2, 3, or 4 different medications. That's called resistant hypertension and always deserves further investigation. Low or borderline low potassium on routine blood work, because aldosterone causes the kidneys to dump potassium as it holds onto sodium, and unexplained muscle weakness, cramping, or unusual fatigue, because low potassium directly affects how muscles function. Primary hyperaldosteronism is absolutely treatable. Depending on whether one or both glands are involved, treatment includes medications that specifically block aldosterone's effects, or in some cases, removal of the overactive gland. When the underlying cause is treated, blood pressure often improves dramatically, and some patients are able to reduce or come off their blood pressure medications entirely under their doctor's supervision. If any of those warning signs resonated, bring this up with your doctor. Ask specifically whether primary hyperaldosteronism could be behind your resistant blood pressure. Suspect 2, the kidney pincher. Most people know the kidneys filter blood and produce urine. What far fewer people realize is that the kidneys are also active blood pressure regulators because they act as blood flow sensors. Your kidneys constantly monitor the blood supply arriving through the renal artery, the main artery that feeds each kidney. Here's where the kidney pincher comes in. Over time, that artery can develop narrowing, plaque building up along its walls, similar to what happens in the heart arteries. When it narrows significantly, less blood gets through. The kidney has no way of knowing the reason. All it registers is that blood flow has dropped, and to your kidney, that means one thing: emergency. Your kidney interprets the situation as if you're severely dehydrated or in dangerously low blood pressure, so it fires off an alarm response. activating a system called the renin-angiotensin system, which you may have seen referenced on the labels of certain blood pressure medications. This system does two powerful things simultaneously. It constricts blood vessels throughout your entire body, and it cranks up aldosterone production, bringing us back to the salt-hoarding mechanism from suspect 1. Tighter vessels plus more fluid in the system at the same time. The result is blood pressure that can spike to truly dangerous levels and becomes extraordinarily difficult to control with standard medications. This is why the kidney pincher is so insidious. Medication after medication isn't working because each one is treating the symptom while the actual cause, that narrowed artery, keeps triggering the same emergency response over and over. Warning signs: sudden unexplained jumps in blood pressure in someone who previously had it well controlled, an unusual whooshing sound your doctor might detect through a stethoscope on your abdomen. That's called a brute, and it indicates turbulent blood flow through a narrowed vessel. And here's a particularly important one. If you're already on ACE inhibitors or ARBs, both very commonly prescribed blood pressure drugs, and your kidney function numbers rose significantly after starting them, that pattern should trigger a direct conversation about renal artery stenosis. Those medications work by blocking part of that emergency response system, and in a kidney depending on that system just to maintain function, blocking it can cause a measurable drop in kidney performance. Effective treatments exist. Imaging studies can identify the narrowing, and procedures can open that artery and restore proper blood flow. When the problem is fixed at its source, blood pressure often improves substantially. Now I want to pause here. If you're over 60 and want clear, science-based cardiovascular health information every week, hit subscribe right now and turn on notifications. And share this today with a senior you care about whose blood pressure has been resistant to everything. Now, the third suspect, and this one surprises a lot of people. Suspect 3, the lead foot. Your thyroid gland, a butterfly-shaped gland at the base of your neck, regulates your metabolism. Think of your metabolism as the engine speed of your body. Your thyroid is the throttle. When the thyroid becomes overactive, a condition called hyperthyroidism, it pumps out excessive thyroid hormone and every system in your body starts running too fast, too hard, for too long. Your heart rate climbs. In some seniors with untreated hyperthyroidism, the resting heart rate is well above 90 beats per minute. The heart is essentially being forced to sprint when it should be walking. Arteries throughout the body experience increased pressure from that faster, more forceful cardiac action. Blood pressure rises, particularly the systolic number, the top figure in your reading. The dangers go beyond blood pressure. A relentlessly racing heart is at significantly elevated risk of developing atrial fibrillation, a condition where the upper chambers of the heart quiver chaotically instead of beating in an organized rhythm. Atrial fibrillation substantially increases stroke risk, and the constant wear of running everything at maximum speed accelerates damage to the heart muscle and arterial walls over time. Warning signs are actually quite distinctive once you know what to look for. A persistently elevated resting heart rate, anything consistently above 90 when you're sitting quietly. Feeling unusually warm or hot when those around you are comfortable. Feeling jittery or anxious, almost like too much caffeine, even without any. Fine tremors in the hands. Difficulty sleeping despite exhaustion. Unexplained weight loss despite eating normally or more than usual. If you're experiencing several of these alongside elevated blood pressure, mention this cluster of symptoms to your doctor. A simple blood test measuring thyroid hormone levels can identify whether the lead foot is your hidden suspect. Hyperthyroidism is very effectively treated. Options include medications that reduce thyroid hormone production, radioactive iodine therapy, or in some cases, surgery. When thyroid levels return to normal, blood pressure improvements can be substantial. Here's the full recap to take with you. Suspect 1, the salt hoarder, primary hyperaldosteronism, where overactive adrenal glands produce too much aldosterone, causing your body to retain sodium and water and push blood pressure up. Watch for resistant hypertension on multiple medications, low potassium on blood work, and unexplained muscle weakness or cramping. Suspect 2, The kidney pincher, renal artery stenosis, where a narrowed artery tricks the kidney into triggering a whole-body emergency response that drives blood pressure to dangerous levels. Watch for sudden, unexplained blood pressure spikes, a whooshing sound your doctor detects in your abdomen, and worsening kidney numbers after starting ACE inhibitors or ARBs. Suspect 3, the lead foot, hyperthyroidism, where an overactive thyroid floods the body with excess hormone and drives everything into overdrive. Watch for a resting heart rate above 90, feeling persistently hot or jittery, hand tremors, sleep problems, and unexplained weight loss. Any one of these conditions, properly identified and treated, has the potential to transform your blood pressure management. I've seen seniors who struggled with resistant hypertension for years finally get answers and experience profound improvements once the true underlying cause was found. If your blood pressure has been stubbornly resistant despite your best efforts, please consider that there may be a hidden cause that hasn't been investigated yet. You are your own best health advocate. Bring these questions to your doctor. You're not overstepping. You're being a proactive participant in your own care. The best doctors genuinely want patients who have done their homework and are asking thoughtful questions. And if you're currently on blood pressure medications, please don't stop or adjust them based on anything in this video. Work with your doctor. The point of this video is to equip you with knowledge and better questions, not to replace medical care. I've put together a free hidden causes guide, a one-page printable covering all 3 suspects, the warning signs for each, and the specific questions to bring to your next appointment. Many of my patients find it useful to hand directly to their doctor. The link is in the description, originally created for my clinic patients and available here for now. Drop a comment below. Did any of these 3 suspects sound familiar to your situation? Which one resonated most? I read every one. Subscribe if you haven't. Share this with a senior you care about whose blood pressure has resisted everything. This might be exactly what changes the conversation with their doctor. Next video, 3 techniques to lower your blood pressure quickly in under 2 minutes. Practical, evidence-based strategies you can use right now, regardless of what's driving your numbers. Link is right here. This video is for educational purposes only and does not constitute medical advice. Never stop or adjust blood pressure medication without consulting your healthcare provider first.